Hello, today's topic is Black people and coronavirus infection. I'm Dr. John. This is one more in a series related to coronavirus. According to the CDC, 33% of people admitted with coronavirus infections are Black people, while only 13% of the United States population are African Americans. For whites, the numbers are 45 and 76 respectively. According to Johns Hopkins University, 34% of deaths due to coronavirus infections were among Blacks. Blacks are not getting infected at a higher rate because of race or genetic predisposition, but because of crowded living conditions and more exposure due to working conditions. Blacks are not dying at a higher rate because of race or genetic predisposition, but because of underlying health conditions such as hypertension, obesity, and diabetes. Blacks are not experiencing these conditions because of race, but because of economic conditions. For example, the median income of Black household in the United States was $41,000 in 1970, while that of white household was $63,000. So Blacks work harder to make ends meet, have less time to prepare nutritious foods, and rely on cheap prepackaged foods, most of which are made from grains and grain flour products, providing more calories but being less nutritious. So, you may ask, why should you care? Let me give you some reasons. If Blacks hold on to the virus because they are not detected or treated, they can give it back, the virus can spread back into the community. More importantly, already 70% of the American adults are overweight or obese. And by 2030, 54 million people will be diagnosed type 2 diabetes. The societal cost of caring for obesity and type 2 diabetics will be $1.5 billion per day by the year 2030. And we will all be paying for it through increased insurance premiums, whether you are affected by it or not. So, what can we do? To control coronavirus, yes, you have to practice social distancing and personal protection measures as already discussed by many people. To prevent the looming healthcare crisis, I suggest two actions. One is our farm policy should be geared more towards the production of vegetables, fruits, and nuts compared to grains. Secondly, the economic disadvantage of Black people and other minorities should be corrected so that they can afford nutritious food and less reliance on grain flour products. If you like this type of information, follow me on Instagram and Facebook, Dr. John on Health, or log on to my website, drjohnonhealth.com.